conversation today is about Dr. Funmi, is about Mobihealth. And the first thing I would like you to start with, which combines your opening remark, is for you to walk us through your journey. Who is Dr. Adewara? Your professional journey, how it all started, right? And give us a bit of your background.
Yes, my name is Funmi Adewara, and I'm a physician by training. And I was born in Nigeria, in northern Nigeria. I grew up in a household of 5. I'm the 4th child, and I have a very pleasant memory of my childhood. So I grew up a very studious, focused child, and I think that endeared me to many of my aunts and uncles. So I was surrounded by very resourceful women. So if I look back at my journey, I think that has inspired my entrepreneurship journey so far. My mom was a businesswoman and worked in the AB teaching hospital. So I used to go with her to hospital a lot of times. That inspired me to study medicine because I saw firsthand the sufferings of people who needed healthcare and were in a very vulnerable state. They were slumped on benches, waiting on a very long queue to be seen by doctors and nurses who were usually very overwhelmed. So that inspired me in a way to study medicine, because at that time, I was a frequent visitor to the hospital, having had my own health problems. I suffered an injury that needed a lot of surgeries. So from a very young age, I was constantly in the hospital. I was on admission. So during the night, sometimes I would hear the wailings of mothers and families who have lost their loved ones, and most of the times to preventable illnesses. And growing in that hospital environment, that kind of spurred me to want to help, So that was what really inspired me to study medicine. And I studied in the University of Ibadan, Nigeria. So I graduated top 1% of my class. I had always had interest in public health. So during my community postings, we went to Adewara. You will see people who didn't have the resources to buy healthcare plans. They don't know what health insurance is. And many of them were just living with chronic diseases, hypertension, diabetes, without knowing it and what to do. So I had always been very passionate about driving healthcare to underserved communities, after which I then proceeded to England, because like what is happening today, many of doctors, 90% of doctors that you interview are on their way out. So when we finish, the first thing on your mind is you want to write PLAB exam, USMLE, you just want to get out of the country because you want better quality of postgraduate training, you want better quality of life and better earning opportunities. So I left for England.